Welcome back to History in the Making. I'm Sharon, and today we will be discussing the life and legacy of Dr. Michael Ellis DeBakey, an American surgeon famed for transforming cardiovascular surgery, increasing the quality of medical education, and influencing national healthcare policy. Dr. DeBakey was born in Lake Charles, Louisiana on September 7, 1908. His father owned a drugstore where he interacted with a number of physicians who inspired him to become a surgeon. After high school, DeBakey attended Tulane University, where he completed his pre-medical education in 1929 and was accepted into the Tulane University School of Medicine, where he earned his medical degree in 1932. While at Tulane University, DeBakey developed the first of many medical innovations, the roller pump. This invention was created prior to the establishment of blood banks and transfused blood directly from one person to another. This device was essential to the development of the heart-lung machine that made open-heart surgery possible. After Tulane, DeBakey began his surgical training at Charity Hospital, where he completed his internship in 1935. He was quickly encouraged to complete his surgical fellowships in Europe before he returned to Tulane University in 1937, where he was employed on the surgical faculty until 1948. At the height of the Second World War, DeBakey served as the director of the Surgical Consultants Division for the Surgeon General in the U.S. Army. He was instrumental in the development of the Mobile Army Surgical Hospital Units, or MASH units, which stationed doctors near the front lines and greatly improved survival rates among wounded soldiers. For his work in the Army, DeBakey was awarded the Legion of Merit Award in 1945. He later helped to establish the Veterans Administration Medical Center Research System. After the war, he returned to Tulane until 1948, when he joined the faculty at Baylor College of Medicine in Houston, serving as chairman of the Department of Surgery until 1993. During this time, DeBakey created some of his most renowned innovations and performed his most famous surgeries. In the 1950s, DeBakey was focused on finding the perfect material to create artificial blood vessel grafts. He went to a department store in downtown Houston to buy nylon material, his first choice, but the store had run out of it. Instead, he purchased polyethylene terephthalate, or Dacron fabric. Using his wife's sewing machine, he created the first Dacron vascular graft prosthesis to repair or replace diseased blood vessels. In the early 2000s, Baylor College of Medicine and Houston Methodist Hospital split into two separate hospital systems, and both hospitals suffered. However, Dr. DeBakey tried to support both through this difficult time. While working as Chancellor of Baylor College of Medicine, he also took on the role of Medical Director of Houston Methodist DeBakey Heart and Vascular Center, across the street from one another, which is now directed by Dr. Alan Lumsden. DeBakey was at the forefront of groundbreaking medicine across the field of cardiovascular surgery. He was one of the earliest pioneers of the coronary artery bypass surgery and a trailblazer in the development of an artificial heart. He was one of the first to use a left ventricle bypass pump, an external heart pump, successfully in a patient. While talking with a NASA space shuttle engineer, who he had performed a heart transplant on, they conceived the first totally implantable, non-pulsatile axial flow pump to assist the heart. These innovations, and numerous others, led to the establishment of Dr. DeBakey as a legend in the medical field. Over the years, DeBakey earned a number of prestigious awards and honors for his work in cardiovascular surgery. Among these awards was the American Medical Association Distinguished Service Award in 1959, the Presidential Medal of Freedom with Distinction in 1969, and the Presidential National Medal of Science in 1987 from President Ronald Reagan. In 2005, DeBakey suffered an aortic dissection and was rushed to Houston Methodist Hospital. In previous years, he had developed the surgical treatment for this condition, and that exact procedure now bears his name. DeBakey became the oldest patient to undergo the surgical procedure and remained in the hospital for 8 months. He was released in September 2006 and lived another 2 years. DeBakey continued to practice medicine until his death in 2008 at the age of 99.